Welcome to your role as an academic clinical nurse educator. Whether you are a clinical instructor, adjunct faculty, or preceptor, you've accepted a truly influential role. Every clinical day is an opportunity to shape the future of nursing by helping students develop the knowledge and clinical judgment they need for safe patient care. Your primary responsibility is to facilitate student learning. You are accountable for providing meaningful opportunities and evaluating performance fairly and consistently. One of your most important tasks is helping students bridge the gap between classroom theory and real-world clinical practice. Encourage students to explain the rationale behind their actions. Ask open-ended questions that promote reasoning, like, what assessment finding concerns you most? Create a clinical learning environment that is supportive and psychologically safe, where curiosity is welcomed and every student feels valued. You serve as a role model. Students observe how you communicate with patients, families, and the healthcare team. Always prioritize patient safety. Providing meaningful feedback is essential. Effective feedback is timely, objective, and focused on specific behaviors rather than personal traits. Whenever possible, provide feedback soon after the event, address safety concerns immediately, and hold detailed performance discussions in private. Invite students to reflect first. Ask questions like, how do you think that went? Or, what would you do differently next time? To build self-awareness. Be specific. Use models like situation behavior impact or continue start stop to give students a clear plan for improvement. Assessment is continuous. Use both formative feedback throughout the day and summative evaluations to track achievement of course outcomes. Remember, your influence reaches far. You are preparing the next generation of safe, competent, and compassionate healthcare professionals. Thank you for your commitment to nursing education and for investing your passion into the success of every student. Your dedication strengthens our profession. One of the biggest challenges clinical instructors face is determining how to keep students engaged when patient care activities slow down. Every clinical day is different. Some days are filled with admissions and procedures, while other days provide fewer opportunities for direct patient care. Downtime does not have to mean lost learning time. In fact, some of the most valuable learning experiences occur during these quieter moments, when students have the opportunity to slow down, think critically, and make meaningful connections. Whenever patient care activities become limited, encourage students to shift their focus from simply completing tasks to developing a deeper understanding of their patients. Encourage them to review laboratory results, diagnostic tests, and medication lists, while considering how each piece contributes to the overall clinical picture. Downtime also provides an excellent opportunity to strengthen clinical judgment. Ask students to identify their patient's highest priority problem and explain their rationale. Have them anticipate potential complications and discuss early warning signs. Ask, if your patient's condition worsened, what would you do first? To promote clinical reasoning. Encourage students to research every medication their patient is receiving, understanding the indication, mechanism, side effects, and required nursing assessments. Reviewing IV compatibility, infusion rates, and medication calculations reinforces safe practices while building the confidence needed for professional nursing. Downtime provides an ideal opportunity for students to practice writing focused nursing notes, documenting assessments, and recording intake and output accurately. Depending on unit policies, students can practice sterile technique, wound care, or IV assessments, becoming more comfortable in the clinical environment. Communication skills can be practiced even when direct care is limited. Students can rehearse bedside shift reports, develop SBAR communication, and role-play difficult conversations. Ask students to identify one evidence-based intervention related to their patient's diagnosis and explain how current research supports that intervention. Encourage students to observe admissions, wound care, or provider rounds. Before the observation, ask what they expect to see. Afterwards, discuss what they learned. Short clinical challenges, like identifying 3 safety concerns on the unit or tracing a medication order, encourage observation and critical thinking without additional patient assignments. Whenever appropriate, incorporate team-based learning activities. Collaborative learning allows students to learn from one another while practicing essential communication and decision-making skills. Every clinical day should conclude with reflection. Encourage students to consider what went well, what challenged them, and what clinical judgment decisions they made. A well-organized clinical day improves student learning and reduces instructor stress. Let's walk through a sample 8-hour workflow to maximize learning. The day begins at 7 o'clock with bedside shift report. This introduces students to effective communication during transitions of care and identifies immediate priorities. Following report, students review patient records. Some focus on medication preparation, while others review lab values and diagnostic tests to identify highest priorities. During patient assessment, work with a few students to validate findings, while the remaining students independently perform comprehensive assessments on their assigned patients. Starting around 9 o'clock, your primary focus shifts to supervising medication administration, requiring your full attention for safe practice. While you supervise meds, the remaining students assist with hygiene, obtain vital signs, perform focused assessments, and reinforce patient safety measures. Late morning is ideal for instructor rounding. Spend 10 to 15 minutes with each student individually to validate findings, ask clinical judgment questions, and provide feedback. In the afternoon, students continue providing care while participating in clinical judgment exercises, medication research, and discharge planning activities. The final 30 minutes are dedicated to post-conference. Students consolidate their learning by presenting their patient and sharing important takeaways from the shift. Clinical instruction is about creating an environment where students know how to use their time productively and continue developing clinical judgment independently. At the start of the day, set clear expectations. When students know what is expected, they are much more likely to remain engaged and take ownership of their learning. Remember, the goal is not simply to keep students busy, it is to keep them learning. Every moment has the potential to become a valuable teaching opportunity. Clinical evaluations are one of the most important responsibilities of a clinical instructor. They provide students with meaningful feedback about their progress, document achievement of course outcomes, and help ensure consistency across the nursing program. In this video, we'll walk through the evaluation process and discuss strategies for writing objective, constructive, and meaningful evaluations that promote student growth. Let's begin by logging into ATI Program Manager. Navigate to the Program Manager login page and enter your faculty username and password. Once you've logged in, verify that you've selected the correct institution and course. Taking a moment to confirm will help prevent errors later. After logging in, select the Evaluations tab from the main navigation menu. Next, locate your clinical course and verify the semester and rotation. Depending on your course, you may be completing a midterm evaluation, a final evaluation, or another scheduled clinical assessment. Once you've opened the evaluation, select the appropriate student and verify that you have the correct learner before entering any ratings or comments. As you work through the evaluation, carefully review each competency and performance indicator before assigning a rating. Your evaluation should always be based on direct observations made throughout the clinical experience, thinking about the entire rotation. Consider their assessments, clinical reasoning, professionalism, and overall progress toward meeting course outcomes. When adding comments, remember that specific feedback is far more valuable than general statements. Good job provides very little guidance. Instead, describe observable behaviors. For example, the student consistently verified patient identifiers and explained medications before administration. As you complete the overall comments section, strive to provide balanced feedback. Begin by recognizing the student's strengths first. Next, identify 1 or 2 priority areas for continued growth, such as prioritization, time management, or clinical judgment. Every evaluation should conclude with a goal. Effective goals are specific, measurable, and achievable, providing clear direction for improvement. Before submitting, take a few moments to review your work. Confirm that every competency has been rated and all required comments are complete. If you're not ready, select Save. When satisfied, select Submit. Keep in mind that submitted evaluations may no longer be editable. Remember that your feedback has a lasting impact. Objective and specific evaluations become powerful teaching tools that promote reflection and confidence. One of the most important responsibilities is providing timely, consistent feedback. Blackboard Ultra's tools and rubrics make this more efficient. Let's begin by logging into Blackboard Ultra and opening your course. Once inside, navigate to the gradebook. Locate the assignment you wish to grade and click on the title to view student submissions. Select the first student to begin. When the submission opens, review the document. Verify it's the correct file and it opens properly before you begin grading. Once reviewed, open the rubric. The rubric serves as your guide, ensuring every learner is assessed using the same standards. Select the performance level for each criterion. Blackboard Ultra automatically calculates the score based on the point values assigned. While the rubric provides the score, your written feedback provides the opportunity to coach students. Begin by recognizing what they did well. Include specific examples and provide suggestions. Feedback that is actionable provides students with clear direction for continued growth. Review the overall score. Verify that any adjustments are appropriate and confirm the correct grade appears in the field. Select Save to return later or Post to make the score and feedback available to the student immediately. After one evaluation, use the navigation arrows to move directly to the next. This allows you to grade efficiently without leaving the submission view. Once all assignments are graded, return to the gradebook for a final review. Confirm every submission has a grade and all evaluations are posted. Remember, grading is about much more than assigning points. Every comment is an opportunity to help students improve their performance. Blackboard Ultra is designed to provide an organized and engaging environment. A well-structured course helps students stay on track. Let's begin by logging in and selecting your course. Navigate to the course content page. This is the roadmap your students will follow. To add new content, simply click the plus sign in the location where you want the item and select Create. Folders are an excellent way to organize by week or topic. Consistent naming makes it much easier for students to navigate. Learning modules are useful for specific sequences. You can even require students to master foundational concepts before moving on. Uploading files is common. You can upload PowerPoints, PDFs, or Word files. Verify they open correctly and are clearly labeled. Consider using a document to combine text, images, and videos. This reduces clicks for students and creates a streamlined experience. When adding links to external resources, always provide a descriptive title and brief explanation so students understand their importance. If your institution supports cloud storage like OneDrive or Google Drive, you can insert files directly from those locations. Create interactive activities like discussion boards, assignments with rubrics, and tests with various question formats. As your course grows, you can reorganize content by simply dragging and dropping items into a new location or editing existing ones. Manage content visibility by keeping materials hidden or using release conditions to make them available based on dates or performance. Before publishing, use Student Preview. Viewing from the student's perspective helps you identify navigation issues before they do. Keep a few best practices in mind, organize consistently, start with overviews, use descriptive titles, and avoid excessive nesting. A well-organized course reduces confusion and supports engagement. Thank you for your commitment to fair, consistent, and supportive assessment.